Hi, this is Dr. Nammy, and I wanted to talk to you today about tongue ties. So, tongue ties are when the tongue cannot move. And the reason why you're not able to do that is there is a little muscle there, and that muscle sometimes is too short. So when the muscle is too short, it doesn't allow our bodies to move the way they need to move, or your tongue to move the way it needs to move. And a lot of times we see this in children. So when we see this in children, it usually is because maybe they were not breastfed, or sometimes they just didn't develop properly. And the tongue tie actually stops them from breathing really well. And that's our main reason for wanting to make sure we address the tongue ties. And when the tongue is not in the right place, it's really hard for the child to breathe properly. And not just children, adults too. It is very challenging for us to breathe right if our tongue is not in the right place. So, the way to test if your tongue is in the right space is if you close your mouth and see where your tongue rests. The tongue should be at the roof of the palate, which is right there. It should be at the roof of the palate, kind of like this. It should be at the roof of the palate. If it's not at the roof of the palate, then you may have a tongue tie. And that tongue tie can make you mouth breathe. It can also cause lots of tonsil to build up, and you'll have a lot of stuff in the back of your throat, sometimes bad breath, um, and maybe sometimes like you get throat infections a lot. That's really common as well. And so we really want to address those tongue ties, and we want to address them early, because the sooner we can get rid of the tongue ties, the better it is for you. The better you can breathe, the better you can speak, the better that everything around the mouth grows in the proper order as it should. So make sure to get the tongue tie checked out. And the easiest way to do it, and see how far the tongue goes down. And if you can touch the roof of your palate and say, N, see how it sounds. The enunciation is really great. That's what we're looking for. Okay, this is Dr. Nami. Just wanted to give you a tip.